Hi, my name is Megan Lavera, and today I will be going over how to take vital signs on your horse. I'll be using Blondie as my demonstration horse and Deanna as my handler. First, I'll talk about the supplies that you need when going over horse vital signs. You'll want a thermometer to take the temperature. Today, I'll be using a digital one. You can also use the mercury thermometers. You'll also need a tube of Vaseline or some kind of lubricant. You'll want a stethoscope to take the heart rate. You'll want a towel to clean off your thermometer, a handler to hold your horse. The first thing that I usually check when going over the vital signs of the horse is that I will go over and check the mucous membranes. The mucous membranes on the horse would be on their gums, in the conjunctiva of the eye, and then on theirs you can check the vulva. We usually check here at school is we use the gums. So to check the mucous membranes, you would lift your lips, take 2 fingers, and push down, and then count how many seconds it takes for the gums to return to their normal color. You want them to normally be pink and moist, and that means healthy and hydrated. Some colors that could indicate problems would be pale could be dehydration, yellow could be jaundice, blue purplish color could be lack of oxygen, and a brick red color could indicate fever or infection. And then the next thing that I usually check on the horses is I'll check their pulse. A normal pulse for a horse would be 32 to 44 beats per minute. The 2 most common areas that we use to find the pulse on the horses would be under the jaw or behind the knee. The less common area would be to find a pulse would be on their foot, which you would not want to be able to find because that will indicate a problem within the hoof, such as founder and laminitis. So first I will take the pulse in one of the normal spots. And to take the pulse, you find the artery under the jaw, and then I'm going to have my handler, Deanna, if she's comfortable timing for me.
Yes. And I have it pulled up.
And I will count the pulse for 10 seconds, and then multiply it by 6 to get the full minute, so that way I'm not having to sit here and find his pulse for a full minute. Okay.
Whenever.
Really good. And it will usually take you a couple tries to try and find the pulse. Hold on. Hold on. Stop. Okay, ready?
Yep.
Go.
Stop.
Okay, so I got 6. So 6 times 6 would be 36, which is fully within the normal range for a pulse. And then, like I said, the other places would be behind the knee, and then on the foot would be a digital pulse, but you do not want to try and find that. And to find that, you just simply go behind their foot and see if you can feel a pulse. And he does not have a pulse here, which is a good thing. The next thing that I will look for is the heart rate, and that will be in the same parameters as the pulse, so you want that to be 32 to 44 beats per minute. And to find the heart rate, this is where you want your stethoscope. And then again, I'm going to ask Deanna to time for me. And I'll do the same procedure as I did before. I will time him for 10 seconds and then multiply it by 6. And when you are taking pulse and heart rate, you want the numbers to match up and be exactly the same. Because if they're inverted, that could indicate a problem. Are we ready?
Yep. Stop moving.
Very good. Okay, ready?
Yep.
Go.
Stop.
Okay. And again, I got the same number as 6, so it would be 36, which is what you want it to be at. Okay. The signs of illness within the horse would be if you heard no sounds whatsoever, if you heard hypermodal, which would be a whooshing constant noise, or if you heard a pinion noise within the 4 quadrants of their stomach. 3, so 3 times 6 would be 18, which that is a little high for them, but we're outside right now with people walking by, so he's a little bit excited. And those are the vital signs of your horse. Thank you for watching.